Hello and welcome to the very first of a five-part series on strategic planning for healthcare provider organizations. My name is Amy Greeter, and I'm a Senior Vice President with Coker Group, and I am delighted to be here today. I am joined by one of my esteemed colleagues, Taylor Coward. Taylor is a manager with the organization, and she and I work together a lot to do various types of strategic planning projects, whether they be for community hospitals or critical access hospitals or independent medical practices. We really run the gamut of provider organizations that we support and service and are blessed to consider our partners. Today, we're going to talk about the strategic planning process overall. We're going to outline how Coker approaches this process, the 5 steps that we really go through to make sure that it's effective for people. And then we're going to make sure that we spend a little bit more time today talking about that first step in the process. We'll then go on in subsequent weeks to talk about the other 4. So today, let's jump in to talk about strategic planning, the whys, the whats, and the hows of how you do it successfully. Taylor and I are building upon work that's previously been completed by Coker. And if you look on YouTube, you can probably find a few of our other strategic planning videos. So we are delighted to augment our library of resources in that vein. I think it's especially timely that we engage in this discussion in the first quarter of 2021, given the impact that we have had in the last year as a result of that has affected so many organizations and so many people, as it's run its course. When I think about the COVID-19 pandemic, I typically think about it in a couple of very key categories. I think about it from the financial aspect. So the American Hospital Association came out with information that it's projecting the impact of COVID-19 to be about a $202 billion impact in terms of lost revenue for hospitals and healthcare organizations. I think at the peak of the COVID impact, about April of 2020, our American unemployment rate hit 14.8%. That means 14% of the available American workforce was unemployed. That's the highest number that it's been since we started collecting this data in 1948. It's a massive amount. For many organizations who are already looking at the financial impact from deferred or otherwise eliminated cases, and then looking at a patient population that had seemingly overnight transitioned to have such a greater component of self-pay or inability to pay, there were some really real financial implications. I think the other significant category of impact has been psychosocial. And so it's very clear to many of us that healthcare workers, as frontline workers, have been at the highest risk group for adverse psychological impacts as a result of the COVID impact. That has changed both how we approach our caregivers and what they do, and how we impact our care for those caregivers. Another key category would be the overall physical impact of COVID. So as we sit here today, there have been 29.3 million cases of COVID diagnosed within America, and we're looking at 530,000 deaths. That's a huge impact. It seems like everybody I know has either lost someone or knows someone who's lost someone. And so it really marks a significant impact on all of us, again, as people. And then finally, another category of big impact in this last year has been the transactional activity. So a recent Ponder and Company report came out that said there were 79 announced deals in 2020. That's down 25% from the trailing 10-year average, and it's the lowest it's been since 2009. So for many organizations who are considering some sort of merger or acquisition activity as part of their overall strategic plan, whether it be growth or efficiency or however those transactions were going to impact your strategic plans, a lot of those have been completely abandoned. And so it's time, I think, as we look at all the changes that have surfaced in the last year, at how do we really address what our strategic future is going to be. The reality is that it is going to be different than what we thought it was going to be when we ended 2019, when we came into 2020. our strategies, our tactics are going to be different now. And so if you haven't already, it's a great time to revisit your strategic plan. We talk about our 2020 bingo card. When people laugh, they make jokes about the fact that, oh, I would have never put that on my bingo card. And the reality is that we're not talking about bingo cards here. We're talking about the health of our organizations. So we really need to do some appropriate planning to figure out, what does our future look like as an organization, whether we're a hospital or whether we're a medical practice, whoever we are, how do we really look at what we need to be doing? This is a process that we should be engaging in regularly anyways, but now it has, I would say, is significantly more import than it may have otherwise had. So at Think Coker, when we think about the strategic planning process, we often think about it with 5 key steps. The first step, and the one that we're going to talk the most about today, is really understanding the starting point. You have to understand where you stand today, the reality of today, whatever it may be. And again, it's different right now than we may have ever had experienced in the past, or certainly where we thought we were going to be today. But we need to understand very robustly where we are. And then as you go through the other 4 stages, it's really determining where you need to be and then charting a course to get there. So when we talk about understanding the starting point today, I think it's a good illustrative story if we talk about Howard Schultz. And many of you may recognize that name. Howard Schultz was the CEO of Starbucks Corporation. In fact, it was Howard Schultz that came to Seattle's Pike Place Market in 1981 and walked into the original Starbucks store. And at that point, they weren't even selling brewed coffee. They were selling beans only. And he had this vision for what could be what he termed the third environment. So it's not your office, it's not your home, but it's this space where people can gather and have a sense of community. And so Howard Schultz talked to the founders and convinced them to give him a job. So he relocated from New York, moved to Seattle, and he started as their director of retail operations. And he began transforming what we think of as a coffee store to a coffee house. Howard had a very robust plan for growth for the organization. And what he did is that he decided that they were going to grow pretty aggressively. So when he approached the group, in 1985, Starbucks had 6 stores, and he said, I want to grow this. He obviously became the engine, the leadership engine. And in 1992, when he took Starbucks public, they had 165 stores. And by the time he stepped down as CEO for the first time in 2000, they had more than 3,500 stores across 12 countries. It was an entirely different organization than the one that he had really started and helped grow. The reality is that Starbucks did not flourish in the years after Howard Schultz left. It came on hard times. And between 2000 and 2008, when Howard returned to his role as CEO, the entire composition of what Starbucks had done and was doing had changed. And so when we talk about understanding a starting point, I think the illustrative point here is that Howard Schultz, when he came back in as CEO in 2008, early 2008, he had to understand that the organization that it was then was not the organization that it had been when he came into the organization in 81, 82, 83. It was something altogether different. And so what he had to do was appreciate the fact that where the organization needed to go was not necessarily where it had been going under his growth or where it had been going in the more recent years. And so on his first day back in his role as CEO, Howard issued a letter to employees. And it basically said, I understand that we have let bureaucracy come between us and our customers' happiness and our own success. And so I understand that we need to change things around to be focused on our customers and what they need, not on our own internal issues or our own internal processes, what we want to do. Our constant look at growth has stymied our ability to see what our customers need now. And so that was really Howard's whole vision, was to figure out how do we get past from where we were to where we need to be going. And so Howard undertook a couple of things, I think, and these are the things that we would implore you to think about as you go through your own strategic planning process. The first is to gather data and to begin to understand what your baseline looks like from a very pure quantitative and qualitative standpoint. Gather the data, work with your decision support people to figure out where is your revenue, where are your costs? What does that look like on a trended basis? How does that compare to where you were 12 months ago? How does it compare to where you were 3 years ago? Get an understanding of where the organization is right now from as many quantifiable data points as you can. And then on the qualitative side, look at getting some input from the people who are within your organization. Start at every level of the organization and approach them to figure out what do they think is working, what's going right, what's not going right. And this is beyond what I would consider the standard town hall where you kind of stand up there as a leader and you share information. The communication has to be effectively bidirectional for you to get the information that you so desperately need to truly understand your starting point. So look for opportunities to really solicit, confidential if needed, feedback from associates within your organization. And that, again, should be your clinicians. It should be your non-clinicians. It should be your support teams. It should be your administrative teams. It should be everybody, your board. Even look, depending upon what size your organization is and what role it plays in your community, look at members of the community. What are they saying? What are they thinking? What do your patients have to say about you, both those that love you and those that may not be as happy? Figure out what they are saying about where your organization currently stands. To loop back to our example about Howard Schultz, I think this is one of the things that Howard did well. He started a concept called My Starbucks Idea program, where he went out and he asked actual customers to relate to each other and to provide feedback directly to the organization about what they were seeing. And when he started that program, they got 1.3 million different users to provide feedback on products and services and corporate responsibility, social responsibility, the in-store music, the layout of the stores, all of those things. And so while Howard had the vision that they needed to get back to customer success and not be fueled by their own desire for growth, he realized that the people who were the end users of their stores, the consumers of their products, were ultimately going to be the ones who could give them the best feedback. So figure out what is the analogous My Starbucks Ideas program for your organization. How do you get that robust feedback that you need from people to really understand where things currently stand? With that said, I'm going to turn it over to Taylor to think about some of the other factors that go into the overall strategic planning process.
Thanks, Amy. Yeah, absolutely. So as Amy said, we get all this data, and when Amy and I start these projects, we go through that process of getting all this data first, right? Having interviews, having conversations, really getting to understand the organization. And as we start to kind of conceptualize what is the starting point, we often break it down to 3 different components, right? And we'll kind of talk about each of those today. And the first one we look at is what's happening in the macro environment. And this one I think is so interesting. And as Amy pointed out earlier, in 2021, as we look back, I think a lot of times prior to 2020, this one got a little bit overlooked because it didn't feel like it's affecting our day-to-day lives necessarily. What's happening in the bigger world is just going to happen and we're just going to have to roll with it, which is true, but it's absolutely going to affect what our strategic plan looks like. And so I think the greatest example of this in 2020 is telehealth, right? So if we look back and we think, okay, we all were talking about telehealth in 2020. It was on our radar. Everyone understood it's coming, but it is coming slowly. And we all were on the same page that should you be thinking about it as organizations? Absolutely. But especially for some of our smaller medical practices that we're looking at this, it was definitely farther down the road and not necessarily something that we were going to throw a ton of resources and money into until some of the bigger institutions started really adapting to it. So then we get into 2020, right? And everything goes completely haywire. And I, was going through some of these different components of macro environment factors. And as we'll look at the end, all of them were affected by COVID in 2020. So, our strategic plan now is going to look entirely different on that one component of telehealth than it did in 2019. I mean, it just has to. We all were forced to adapt to these macro environment factors. And now our strategy is, well, how do we actually, now that we have it, now that it's fully here, now that we've all used it, how do we integrate it into our ongoing strategic plans, and how does it modify some of the things that we had going on? I think we've seen this also with just the shift in patient dynamics, et cetera, of people not wanting to necessarily go into the hospital, but these ambulatory systems, et cetera, we're clearly seeing that shift. And in the patient dynamics, our strategic plans are going to fully change. So some of the industry-wide dynamics that we're looking at here are, regulatory. Talk about a change in 2020 that also happened. We have a completely new president in place, a completely new administration, a new secretary of DHS. So all of those things are completely different this year. And so those are going to change how we make strategic plans, what we look at, et cetera. Financial, what's happening in our communities? Are we in a recession, et cetera? Again, something that's clearly significant this year as our organizations are struggling, as our communities are struggling, how we as a healthcare organization fall into that. Population, what's happening in migration, out migration in our service area. If you look at places, I'm in Atlanta, Amy's in Charlotte. And I think both of us are seeing this influx of people from New York that are coming out. And so when our healthcare organizations up there are looking at what are our communities doing, that's a really interesting one. And then, of course, we all look at the aging population. We've been talking about this for years, but our patients are aging, and what is that going to look like as an impact on our strategic plan? Healthcare utilization, this is what I was referring to earlier. What do our patients want in their healthcare? Are they looking to move to more ambulatory settings? What's going on there? Are they willing to use telehealth, et cetera? And then, again, we kind of added this one as we're kind of going through it, but what's happening in the health of our population? Again, we look at COVID and it completely changed everything we were doing. The most similar one is the flu, and that's not necessarily going to change our strategic plan, but it may change some of our minor initiatives that are going on during those seasonalities. So I think these are just really interesting. And again, if you look back in 2020, these were all highly impacted. And it's just something that we have to keep in mind. What is going on in our community? What's going on with our payers, et cetera, that's going to drive all of these strategic planning initiatives. And again, I think in 2019, sometimes these got somewhat overlooked just because they felt so out of our control and not something that we could necessarily change personally, but they are here and they're important and they're impactful. And I definitely think that it's something that we will see much more discussion about going forward. The next one we look at is market factors. So taking it from the broad and bringing it in just a little bit more, we're talking about really what's going on in our specific market and in our specific community. So Amy, I said earlier, is from Charlotte. One of the examples that I'm going to talk about here is when you talk about Atrium Health and Novant in Charlotte. So Atrium, previously Carolina's Healthcare. This is one of the biggest battles in healthcare, right? And if you're from this community, you know about it. It is clear. And even if you're a patient in the community, you know about it. It is big and it is relevant. And there's obviously a lot of these examples. And in your community, you can probably think of them, especially if you're in a larger metropolitan area with multiple health systems. But this is always relevant when they are looking at what they're doing, right? It has to be, what am I doing in comparison to this competitor? And so, we look at the history. Carolina's Atrium is significantly larger and has been around for a good bit longer. But in the last 10 years, Novant has completely become a player in this market. And now the two of them control all the hospitals in Mecklenburg County. And if you aren't familiar with the area, Mecklenburg County is Charlotte is the seat of Mecklenburg County. And so they've taken over all the hospitals in the area. And now they competed inward, right? And now they're starting to compete outward, with Novant going up toward Virginia and Atrium coming down kind of into the Georgia area. But they are still completely at competing with each other in every dynamic. And I promise you, every time these people sit down to have their strategic planning discussions, they're looking at what is my competitor doing in this market and how do I remain a player? Because something like this is so easy, right? There's so easy for them to start losing market share in any given category to each other. And so remaining competitive year after year and keeping that edge is going to be crucial for them. So again, that's just a quick example, but there's a couple of, different things here at play. So, your competitive position, like we just talked about, how are you stacking up against different service areas? I mean, when we look at some of these, sometimes maybe your service area strength isn't going to be in a certain one. And maybe you kind of let that one, fall in terms of priority and things like that, but you clearly have a strict edge in a different service area. So you focus on that and you try to create your market share in that way. Patient patterns, again, where are your patients coming from and where are they going to? If they're, obviously not using this example, but if they're leaving your community, where are they going to and what's drawing them there? What is keeping them from staying in your area? Partnerships, again, this one is huge. How can you partner with either other health systems in your region or in your community, or how can you partner with your medical practices that are there? I think Amy and I have worked with a number of practices in that Charlotte area, and it's been interesting because when we look at it from a medical practice standpoint and we're looking at their strategic plans, these health systems even have to think about that because they can say, well, if our health system isn't willing to work with us and they're not being a strong partner for us, we can go to that other health system very easily. And so, when we look at that, the opposite of that, which is if one of those health systems or one of those medical practices, bites the hand that feeds them, so to say, those referrals could be, taken off. And so we have to look at not only how do we compete, but how do we partner? How do we keep ourselves somewhat insulated in a lot of ways from additional competition that we may not want to bring upon ourselves? And so I think that this is just a really interesting one. I think obviously this one gets a lot of focus when we talk about strategic planning, right? I mean, I think this is where we see the moneymaker, right? How do we create more market share? How do we keep our patients happy? How do we keep them within our primary service area and really satisfying the needs of our community? And so this is, I would say, when we talk about it, a lot of times what we focus on, and to our point earlier, there's broader scope and there's even smaller scope than this, but this is obviously very critical and we don't undermine that at all. But this tends to be what we look at the most, right? What is our base? What is our market share? Where are we losing, et cetera? And this one definitely comes to mind when we think about strategic planning.
Perfect. Thanks, Taylor. I think as we understand the current state, Taylor's done a great job identifying what do we think about in terms of the macro environmental factors? What do we think about in terms of the market factors? I would add to that, we also have to consider what are the internal factors. So another illustrative story here, I think a lot of Ursula Burns. Ursula Burns started as an intern at Xerox in 1980. She ascended through the ranks, ultimately becoming the CEO in 2009. That's notable for me and important to me because when she did it, she became the first African-American woman of a Fortune 500 company. And she became the first woman to succeed another female CEO in that role, which I think is awesome. And so one of the things that Ursula Burns had to do is she had to contend with the fact that, as even the New York Times identified, Xerox was already being used in the past tense when she came on board, meaning Xerox had become a dinosaur right before everyone's eyes. And so their focus on being a hardware company was just not keeping relevant with how the market was changing. And so she had to sit down and figure out what is going on here internally in terms of our drivers for success and our potential drivers for future success. And I think we have to have that same line of thought as we think about our organizations in this overall strategic planning process. We need to be thinking about, where are we financially? If you were one of the organizations that experienced a significant change in financial position in 2020 as a result of COVID, you are not alone. But that does change your ability to fund new projects, to take on new risks, all those kinds of things. You have to be cognizant of what your financial performance is going to allow you to do and what chances you're willing to take, because you may need to be a little bit more conservative in terms of what you do so that you continue to maintain the overall financial viability of an organization. I think it's important that we also think about our clinical services. So what services are we offering right now that are relevant and that we need to continue? Or, as Taylor alluded to earlier, what are ones that we're providing right now but necessarily aren't our core services going forward? Are there new things that we need to add? The same is true about our provider base. Do we have an aligned set of physicians, whether it's through employment or professional services agreements or other sort of contractual arrangements that allow them to be fully integrated into our organization, to be acting as true partners to our organization? Do we have the specialties that we need? Do we have the subspecialties that we need? For many organizations, it is difficult to get an appropriate volume of subspecialists to provide the demand that is there within the community. Well, do we have to do that? Do we have to recruit for those specialties or subspecialties? Or do we have an opportunity to partner with others to really service the community in the most efficient and effective manner for all of us? And then finally, think about the culture of your organization. And I would say here that, again, goes back to the Ursula Burns story. One of the things that Ursula reported in a 2018 interview with Yale Insights, she had stepped down from her role at Xerox in 2016. She'd been there 36 years. And as she was reflecting on how do you bring about change in our organizations, what she stated was something to the effect of, it's often hard as a leadership team to recognize that everything that you've built, everything that you've been a part of to date needs to change for you to be successful going forward. You, in essence, have to throw out everything that you've done to date and be willing to take a risk on what you see as the need for your organization to pursue in the future. And so the appetite for that sort of change is also important for you to address. Is the organization going to support the leadership team in doing that? Because as we all know, it's easy to lead a team of one. It's much more difficult to do that in our healthcare organizations, where there are teams of people, different drivers that have to buy into this vision that we cast to really have this be effective in its implementation. So thinking about those internal factors are likewise a critical component to the overall strategic planning process. So to bring us home, Taylor, why don't you summarize what we've talked about today, and then we can touch on where we're going to go in our second series.
Yeah, absolutely. I mean, I think basic message here is, to understand where you're going, you've got to understand where you are, where you're starting from. And to Amy's point, it's a little bit of this sunk cost mentality, right? Where, I think a lot of times when we start meeting with organizations, there's this feeling of, well, this is where we've always been. This is where this is what we put our money and our strategies into. And while that's important, understanding maybe that's not working. Maybe there are bigger issues at play here. Maybe there's other things that you're not considering that are playing into why those strategies right now aren't really what we need to focus on going forward. And so we like to really, and this is why, Amy and I like to come in kind of from a third party perspective, because sometimes there is so much emotion tied to, these items. And so it can really be this interesting, explanation where we come in and we say, this is what we're seeing. But it doesn't have to be someone external. It can be internal, absolutely. But really taking that time to step back, which I think a lot of times we try to skip over this part, right? And just get to what are the strategies. But it's so important to understand where you're starting from. And, one example comes to mind. Amy and I were working on a project, and the health system, we were working on a strategic plan for them. And really, as Amy and I got in there, realized that we didn't have a lot of discussions planned with the physicians. And as we had these conversations, we realized that one of the main issues was just this trust factor, that the physicians felt like they weren't ever included, and administration felt like, well, they don't ever want to be involved and they don't want any more meetings, et cetera, which, the meeting thing, I think we hear a lot. We don't want to have to participate in more meetings. So why are we going to make them? We just said, we've got to take a step back and talk about, this internal issue of trust. And so we just really made sure that moving forward, we included all parties in these discussions, and we really made it a collaborative process that definitely worked better in the long term for actually seeing these initiatives to fruition, because you need partners on both sides to be able to make anything work. And we'll talk about that a little bit more in some of our future strategic planning discussions. But, again, taking stock, taking inventory. Where are we now? What are the issues we're facing? What makes these headaches for our administration? What makes headaches for our patients? What makes headaches for our physicians? And just really understanding that big picture is so critical. And so, I think that one of the things that people do a lot, and that we do a lot too, and if you've ever taken a business course, the SWOT analysis, right? Strengths, weaknesses, opportunities, and threats. I think sometimes that feels a little bit cheesy, but it is so important to take a step back, and maybe you don't even have to call it a SWOT analysis, but really understand what is happening, broadly in our market and internally, and then using that as the foundation for your strategies going forward, and making sure that everything is rooted in reality of what's happening now and what you really realistically can support and can do and will be beneficial to your organization in the long term.
That's right. Well, thank you very much for joining Taylor and I today. We hope that you have a good understanding of the importance of understanding your current state within the overall strategic planning process. We look forward to you rejoining us for our second series, which is going to be about how do you figure out where you need to be going? What does that end point need to be in your journey throughout this process? We'll look forward to you joining us then. And until then, stay safe and well. Thanks so much. Bye now.
Thanks.